Let us walk you through the process of amoeba pathophysiology, and then it causes infection. Firstly, cysts are ingested through mouth. The cysts are a relatively inactive form of the parasite that can live for several months in the soil or environment where they were deposited in feces. The microscopic cysts are present in soil, fertilizer, or water that's been contaminated with infected feces. These cysts will move from stomach to ileum and convert themselves into trophozoites. The trophozoite stage is the feeding stage of the protozoan, whereas the cyst stage is the dormant, resistant, and infectious stage of the protozoan. These trophozoites will penetrate the intestinal wall, specifically in the colon. Now these trophozoites will multiply within colon wall and will lead towards systemic invasion, particularly in the liver. However, the remaining inactive forms or cysts are discarded with feces. Systemic infection may last for years if left untreated, while symptoms take from a few days to a few weeks to develop and manifest themselves, but usually it is about 2 to 4 weeks. Symptoms can range from mild diarrhea to dysentery with blood, coupled with intense abdominal pains. Therapeutic agents for amebiasis are classified as luminal, systemic, or mixed amoebicides according to the site of action. For example, luminal amoebicides, for example paramomycin, and iodoquinol act on the parasite in the lumen of the bowel, whereas systemic amoebicides, for example chloroquine and dihydroemetine, are effective against amoebas in the intestinal wall and liver. Mixed amoebicides, for example metronidazole and tinidazole, are effective against both the luminal and systemic forms of the disease, although luminal concentrations are too low for single drug treatment. Let us talk a bit about mixed amoebicides. Metronidazole, a nitroimidazole, is the mixed amoebicide of choice for treating amoebic infections. Amoebas possess ferredoxin-like, low redox potential, electron transport proteins that participate in metabolic electron removal reactions. The nitro group of metronidazole can serve as an electron acceptor, forming reduced cytotoxic compounds that bind to proteins and DNA, resulting in death of the E. Histolytica trophozoites. Tinidazole is a second-generation nitroimidazole that is like metronidazole in spectrum of activity, absorption, adverse effects, and drug interactions. It is used for treatment of amebiasis, amoebic liver abscess, giardiasis, and trichomoniasis. Tinidazole is as effective as metronidazole, with a shorter course of treatment, but it is more expensive. Alcohol consumption should be avoided during therapy. Why don't we grab some knowledge on luminal amoebicides? Iodoquinol, a halogenated 8-hydroxyquinolone, is amoebicidal against E. Histolytica, and is effective against the luminal trophozoite and cyst forms. Adverse effects of iodoquinol include rash, diarrhea, and dose-related peripheral neuropathy, including a rare optic neuritis. Long-term use of this drug should be avoided. Paramomycin, an aminoglycoside antibiotic, is only effective against the intestinal, luminal, forms of E. Histolytica, because it is not significantly absorbed from the gastrointestinal tract. Paramomycin is directly amoebicidal and exerts its anti-amoebic actions by reducing the population of intestinal flora. It is also an alternative agent for cryptosporidiosis and giardiasis. Gastrointestinal distress and diarrhea are the principal adverse effects. Moving on towards systemic amoebicides. Chloroquine is used in combination with metronidazole, or as a substitute for one of the nitroimidazoles in the case of intolerance, to treat amoebic liver abscesses. It eliminates trophozoites in liver abscesses, but it is not useful in treating luminal amebiases. Therapy should be followed with a luminal amoebicide. Chloroquine is also effective in the treatment of malaria. Dihydrometine is an alternative agent for the treatment of amebiasis. The drug inhibits protein synthesis by blocking chain elongation. Intramuscular injection is the preferred route since it is an irritant when taken orally. The use of this IPAC alkaloid is limited by its toxicity, and it has largely been replaced by metronidazole. Adverse effects include pain at the site of injection, nausea, cardiotoxicity, such as arrhythmias, and congestive heart failure, neuromuscular weakness, dizziness, and rash. So, this brings us to the end of the video. Keep watching more informative lectures like these on sqadia.com.